with the skin. Abdominal enlargement, obesity. Stria gravidarum has the patient with suprarenal tumor. So, but if patient has these signs, it's presumptive signs of pregnancy. If patient not use contraception during reproductive period, younger and want to be pregnancy, значит more than 15%. Linea nigra, we can see this picture. White line change during pregnancy into linea nigra. Probable objective signs. It's doctor diagnosis with signs, but not 100. More than 50, but not 100. More 50, less 100. Hagar sign, Goodell signs, ballotment of the uterus, positive pregnancy test in brackets, right? Plasma, chorionic gonadotropin. Braxton Hicks contraction, Chadwick signs, and pulsation of the vessels between uterine body and cervix. Hagar signs, softening of the low uterine segment, softening the place between body and cervix. It's method vaginal examination by manual. Ballotment of the uterus according cervix. No, it's doctor's opinion. Да? Вот for patient objective, for doctor's doctor. One doctor think patient has the signs, non-experienced doctor, вот like you, student, да? Postgraduate, допустим, will be postgraduate student, can mistake, тогда not think patient pregnant. But all of these signs we should write and say on exam. 1, 2, 3, 4, 5, 6, 7 sign. 7 sign. And true sign, positive. Absolute right, doctor. Have found these signs, objective signs, without mistake. Attention. Here in this slide, we can't see beta-chorionic gonadotropin. Да? Can't. No, beta-chorionic gonadotropin is not true signs. Possible to have pregnancy, disease, gestational trophoblastic tumor uterine associated with the highest level chorionic gonadotropin. Now, that is why, что там, Агуша, что, Лаура, what question?
Yes, ma'am. Ma'am, we can only see the first slide, and we are not seeing the remaining one.
Что? Я не поняла. Not see?
Yeah, we only seeing the first slide.
Now continue first slide у вас, да?
Slide haven't changed.
Сейчас еще раз, давайте попробуем. Давайте. Так, do you see first slide? Second.
Yes, ma'am.
Introduction. Есть, да? Есть? Yeah. Do you see second introduction? Yes. Slide definition, do you see?
Yes, madam. Yes, madam.
Так, ну, пожалуйста, вы можете сделать фото. Так, next slide. Role of prenatal care, do you see, doctors?
Yes, madam.
Так. Signs of pregnancy. Presumptive. Subjective.
Yes, madam. We can.
Хорошо. Probable, objective.
Yes, madam. We can see.
Хорошо. And the positive signs of pregnancy.
Yes, madam.
Ну, давайте, let's вот this format. Хорошо, вот this format of presentation. Потому что big format, что-то тут интернет, наверное, problem with internet, I think. Итак, positive signs of pregnancy, да? Значит, patient pregnant. So, we know patient pregnant. When visualization of the fetus by ultrasound. Pregnant patient, pregnant. We can see fetus. Objective, objective. Can we do photo? Can. The minor by the doctor. Can think pregnant, but it can be peristaltic support. А вот by doctor, especially use Leopold Manius fetal head, fetal legs, fetal hands, Botox, да, and reactive, fetus scan reactive for the doctor's palpation. Fetal heartbeats by ultrasound machine or by fetoscope. Pregnancy is divided into trimester. It's another examinal question. What 1, 2, 3 sentences. Значит, trimesters of pregnancy, classification of pregnancy. Pregnancy classified on in-term, pre-term, post-term. In-term 37, 42. Pre-term 22 till 37. Post-term 42 and more. In-term 37, 42. Pre-term 22 till 37. Post-term 22 weeks and more. And all of this variant of pregnancy divide on 3 periods. What you're studying here, да, divide to semester. Autumn, summer, or autumn, spring, да, first, second semester. During pregnancy, 3 periods, that is why I named trimester. First, finished by placenta formation and chorion and embryon, I said, chorion future placenta, embryon future fetus. Second and third trimester, placenta and fetus. Вот this slide, please copy to do. Prenatal screening and prenatal diagnosis. It's prompt for you on exam. Prenatal screening and prenatal diagnosis. What is the screening? Screening, it examines all persons. Population of country, population of town, students in medical university, in the child, for example, in the school, all boys, for example, or all girls 12 years old. То есть all of persons, it's screening. Так вот, screening prenatal, all pregnancy examination. In our country, prenatal care is government program, it's free for all pregnant women. Absolute free. Screening tests, screening for diagnose maternal problem and screening for diagnose future baby, infant problem. Итак, first trimester screening, blood test, 9-13 week gestation, то есть 9 till 14, it's the end of first trimester. Ultrasound plus plasma test. Итак, ultrasound plus plasma test. Blood test or plasma test are two main genetical tests. It's later. PAPP, chorionic gonadotropin, and typical test, or typical. Hepatitis, HIV, rubella, syphilis, thalassemia for some countries, да? And if test for genetical disorder positive, PAPP и chorionic gonadotropin, we will recommend invasive screening test like chorionic villus sampling. Amniocentesis and placenta, it's like chorionic but later placenta centesis. Итак, it must be done in the first trimester. Second trimester, control, ultrasound control for the fetal system organ structure. Blood test between 14-80, ideally 15-17 weeks gestation. What kind of blood test? Torch infection, TO-RCH infection. Diagnostic test. Prenatal screening focuses on finding problems among large population with affordable and non-invasive method. Non-invasive, take only blood. not function uterus, да, not take part of placenta, not take part of the fetus function umbilical cord chordocentesis, not take amnion, то есть non-invasive, not take product of conception tissue. It's called non-invasive, only maternal blood. Итак, maternal serum blood test. Вот, please copy this slide. Pregnancy associated plasma protein. Doctors, not say, not on exam alpha-fetoprotein, not used. More than 10 years. Recommendation of World Health Organization, pregnancy associated plasma protein test. And second test, you know this test, это beta-chorionic gonadotropin. Proportion between two tests, PAPP and beta-chorionic gonadotropin, demonstrate and it's blood test, and second one, ultrasound. What your answer on exam, screening pregnancy test, answer will be ultrasound. Second one, maternal serum blood test. Chorionic gonadotropin plus PAPP, pregnancy associated plasma protein. So that's all. Other tests, syphilis, human HIV, rubella, and other can be done later. It's risk of infection. It's not risk of genetic chromosomal disorder, and can be done as before 10-14 as later. Non-invasive prenatal testing, also called a cell-free DNA test. It screens mother's blood for evidence of chromosomal changes in the fetus, which is mostly recommended for women with abnormal first trimester screening results and those at higher risk for chromosomal problems due to their age, family history, and other. Chorionic villus sampling. It's test invasive sampling, chordocentesis, amniocentesis, placentacentesis, choriocentesis, amniocentesis, chordocentesis, and later when placentacentesis. What chorio and placentacentesis look like, it depends on gestational age. Other tests typical for all variant of screening. Screening of children in the school, screening of student in a university, screening of doctor in maternity hospital as I and our colleagues. Typical, what are? Blood test, urine test, test for different aggressive infection. Syphilis, HIV, hepatitis, gestational diabetes, it's typical. It's not specific for pregnancy, but must be done when patient first visited doctor with their pregnancy. Prenatal screening and prenatal diagnosis. What's test more important than common blood test? More important. Blood group are RH group, RH status. Why? RH negative is the risk for in RH incompetence pregnancy, especially patient multiparent. First baby RH positive, in mother RH negative, it's risk for the second baby antenatal death. It's future topic, doctors. It's topic RH incompetence pregnancy. No, we only keep in brain. RH status, we must know during first visit to prevent future collecting antibody to RH. RH is protein. In Europe, 30%, in Africa till 5%, Malaysia 30%, India, Sri Lanka different from 3 till 12%. What different person? No, it's every third patient can has RH negative blood. If father RH positive, fetus can be RH as positive as negative. If first pregnancy, minimal risk. If second pregnancy, risk highest. Итак, вот this slide we can see in your textbook. This slide mistaken. Вот так. Мы не запоминаем. Especially вот альфа-фетопротеин. Оставляем только рионигонадотропин. Вместо альфа-фетопротеина у нас что? Альфа-фетопротеин. P у нас. In some countries, estriol. Ну, вот так вот мы половинку. In only, not all countries, estriol. Ultrasound, вот this is ultrasound. Ну, it's ultrasound examination. Итак, у нас с вами все, доктор, that's all. Вот it's your answer on screening test during first trimester, да? Estriol in some countries according guidelines. Вот this one, PAPP. Все, in the world, вот only this variant. All of this non-invasive test. Non-invasive. Так, как мне это убрать? Сейчас. Итак, это понятно? Do you understand me, doctors?
Yes, ma'am.
Все понятно.
Yes,
Значит, my accent, attention, your attention for examiner answer. Пожалуйста, please. At this slide, we can see invasive test. If result of non-invasive, not satisfactory. If patient has highest risk chromosomal disorder, 18, 21 chromosome especially. 21 chromosome disorder is Down syndrome, right? First place in all chromosomal disorder. Значит, invasive test. Вот, amniocentesis test, choriocentesis in first slide. This is amniocentesis, choriocentesis. During third trimester prenatal screening is diagnosis of the fetal condition. What are, first of all, glucose tolerance test, то есть we should diagnose has the patient diabetes mellitus. This diabetes start during pregnancy, or hasn't. Usually, in our country, first time 24, in more countries in the world 32 weeks, third trimester. And non-stress test. Non-stress test is test during cardiotocography. It's reactive fetus will fetus demonstrate reaction for the some look like exercise. Ballotment of the fetal head, stop maternal breath, or what? Or what? Movement it felt by mother. Non-invasive instrumental methods of examinations for pregnant women. Ultrasound, Doppler, cardiotocography, fetal biophysical profile. We have question at exam ultrasound. We have ultrasound Doppler. We have will have cardiotocography and we will have fetal biophysical profile. 1, 2, 3, 4 questions. Итак, first of all, ultrasound can find signs of intrauterine infection, fetal placenta insufficiency, it's indication, да, for ultrasound, intrauterine growth restriction or retardation, small fetus, hypotrophic fetus, fetal organ development, diagnosis of pregnancy, implantation of placenta previa of or normal localization placenta, stages of labor. No, this is biggest question. Stages of labor diagnosis by cervicometria. No, it can be during pregnancy, short cervix and open cervix. Значит, it's not absolute right. It's can be discussion at exam. You will answer stages of labor. Fetal light position presentation, engagement and size of the fetus, especially weight of the fetus. Ultrasound machine calculate fetal weight. Anatomical examination. When in ultrasound, how we know fetal weight? The ultrasound doctor will measure biparietal diameter, size of the fetus during ultrasound, femur length, size of the bone, transverse truncal diameter, anterior posterior truncal diameter, front occipital diameter, head circumference, abdominal circumference. What is the Dopplerimetry? Dopplerimetry is non-invasive ultrasound method, variant of ultrasound investigation, in addition with use of B-way scanning, то есть scanning of blood flow circulation to detect and distinguish different blood vessels and diagnose activity of the blood between maternal vessels, uterine artery, placental vessels, and umbilical cord to the fetus, and fetal vessels, especially brain vessels, fetal brain vessels. And third method, fetal cardiotocography, method used to monitor simultaneously indications, fetal distress, evaluate strength of uterine contractions, help manage use of uterotonics. When every visit of consultation, so visited prenatal center, first trimester, how many times in first trimester doctor visited doctor? First trimester, every month. Second trimester, every 2 weeks. Third trimester, every week. And cardiotocography must be done. And we can diagnose objective method, diagnose fetal condition, normal heartbeats or abnormal, reactive or reactive, non-stress test positive or negative, and uterine tonus present or absent. Has the patient risk of preterm labor? Non-invasive instrumental methods of examination for pregnant women is biophysical profile. How we can answer for the question biophysical profile? Biophysical profile. There are 5 signs: fetal breathing movement, gross body movement, fetal tone, reactive fetal heartbeats, and amniotic fluid index. Amniotic fluid 5. Bishop score, cervical effacement. How many parameters, indicators, scale, doctors? Cervical size, localization, characteristic, да? Cervical canal, characteristic, localization. 5. Apgar scale, condition of the fetus. Cry of the fetus, color of the skin, muscle tone, fetal heartbeats, reflex. 5. Usually in all scales in obstetrics, 5 parameters. Biophysical profile, 5 parameters too. Значит, at exam we should describe all of these parameters. Fetal breathing movement, how we know? Fetal breathing intrauterine. Yes. It's repetition of future respiration. One episode in 30 during 30 seconds in half hour. Present, normal. If absent, question about life fetus or death. Gross body movement, 3 movements in 30 minutes. Fetal tone, what is fetal tone? It's normal attitude, doctor. Flexion of the hand, legs, and fetal head, flexion to fetal chin near the chest. If Cincy put brown face presentation, it's a sign of hypoxia. It fetal tone abnormal. Reactive fetal heartbeat acceleration. It's cardiotocography or non-stress test by fetoscope. Before test 140, after stop of breath 160, 1 minute later 140. Test positive or not, doctors? Is the test positive or not? Good test, positive. Increased during physiological hypoxia, stabilized when normalized oxygenation of the blood between mother, placenta, and fetus. And amniotic fluid index. Amniotic fluid index 1 pull, да, or 4. Значит, amniotic fluid index at normal, all fluid in the uterine cavity 25 centimeters. Вот запомните, 2 to 25. If less, oligogidramnion. If more, polygidramnion. Ultrasound. What can we see in ultrasound? Absent one menstruation, we can see only point. Зачем? Why visited doctor? Only point. We can't determine. Embryon would like this, да, 7 weeks embryon. Chorion, white color around. Amniotic fluid, it's black. То есть we can diagnosis, uterine structure, product of conception, number of fetuses, and adnexal mass. In this picture, we can see bladder, adnexal mass not visible. Uh, 3 millimeters, it's highest risk of Down syndrome. Also, we should check nasal bones. What nasal bone? It's horizontal white line. Nasal bones must be 2, and size of this bone should be according gestational age, special table. Uh, 3D. What 3D doctors, ultrasound doctor not like? Why? No, it's difficult for using this method. Only fluid around the embryo, we can see what like in this picture. And can't measure the bones. We can't diagnose gestational age. We can check only variant of malformation. То есть diagnosis of pathology must be done in 2D, a detalization in 3D. But pay more of patient like the 3D and portrait, portrait of the future baby. No, it's portrait not interesting for doctor interesting baby's health. Second trimester. In second trimester, diagnose anomalies, what like Down syndrome, like pathology of maxilla. The characteristic of twins can be relief for one fetus and anembryonia. One fetus present, another one absent. It's anembryonia called. Twins is pathological pregnancy always, and that is why control for twins more activity than single. Placenta localization, where is placenta? In second trimester. Look close to the internal walls or not, or left side, right side, fundus, and other. Ну, check the lungs, check the colon, check the characteristic of scar on the uterus, heart pathology, brain pathology, and other. All this specific must be done in second screening second trimester is ultrasound. Invasive instrumental methods of diagnostic: amnioscopy, amniocentesis, chorion biopsy, and chordosynthesis. In this picture, we can see chordosynthesis. Uterus, placenta in the fundus of the uterus, fetus longitudinal like head presentation left lateral, and using ultrasound control, doctor, что? Punctating, да, or by needle, longer needle, umbilical cord vessel. And take fetal blood. Для чего? For what? For the synthesis. For chromosomal abnormalities of the fetus. But this method with the biggest side effects or complication: excessive bleeding from umbilical cord, and fetus can be dead. That is why primary we used chorion biopsy. Chorion biopsy, biopsy of placenta. Chromosomes the same like fetal. And that is why we should take Willi biopsy, it's chorion biopsy too, or placenta synthesis, значит, choriosynthesis, placenta synthesis, take smallest part of the chorion or placenta for diagnose chromosomal disorder. If not effective or genetical pathology, we can recommend patient of chordosynthesis. Patient we should write, put signature about possible complications. Amnioscopy or amniocentesis. Amniocentesis take off the amniotic fluid. Amnioscopy is visualization of amniotic fluid, characteristic fluid like water, or fluid with the blood, or fluid green with the pus, or fluid, another variant of pathology. Amniocentesis, we can see doctor use the ultrasound transducer and punction through the anterior abdominal wall above symphysis, through the uterine anterior wall, placenta in another place, another side, and doctor take off amniotic fluid for laboratory test, for cytogenetic analysis. Chorionic Willi sampling can be done through the cervical canal if patient visited doctor in first trimester. Minimal complication, minimal risk of miscarriage. Take 1 Willi for chromosomal disorder. If blood test PAPP, chorionic gonadotropin, was demonstrated, risk of chromosomal disorder. If not chromosomal disorder risk in blood test plus ultrasound, not, we haven't indication for invasive procedure. Amniocentesis, chordosynthesis, placenta synthesis, always with ultrasound control. And usually choriosynthesis first trimester, amniocentesis, chordosynthesis, attention, 16-18. Start second trimester. Смотрите, как мы, да, function, take amniotic fluid, separation the cells, and diagnosis of disorder. At this picture, we can see chordosynthesis with ultrasound control, placenta, umbilical cord, 3 vessels, and needle function of umbilical cord. Contraindication for procedure. Placenta previa. Placenta previa without procedures, highest risk of abruptio and death to patient, fetus and mother. Premature membrane rupture, oligogydramnion. Patient has highest risk pregnancy termination and intrauterine infection. Cerclage, patient had cervical effacement preterm. Doctor, suture, the cervix closed. We haven't indication for invasive procedure. Incompetence cervix. Incompetence and large opening cervix. Not invasive procedure will stimulate opening complete and start premature labor. Previous history of C-section, scar on the uterus, highest risk, rupture of the uterus by previous scar. Relative contraindication, multiple gestation, history of classic cesarean section. Classic it's vertical from fundus to cervix. Third trimester. After week 32, the baby's central nervous system has matured and starts for regular the body temperature. The baby starts practically breathing through the lungs have not full form. The baby begins to detect light and pupils contract accordingly. Что важно? What's important? What important for the doctor? Is the fetal weight and structure according gestational age or not? Is the fetus mature according the gestational age or not? Two variants can be fetal growth restriction or retardation or macrosomic baby, or absolute according gestational age. Method of diagnosis: palpation, Leopold-Manners, fundus height, abdominal circumference calculation, the fetal weight, and ultrasound. So it's by palpation and measured by doctor and ultrasound. And by physical profile check we can use to in always during ultrasound. Non-stress test, I said, you uterine contraction. Uterus contraction, spasm of the vessels, what reaction must be? Hypoxia, physiological. Increase heartbeats. In this picture we can see not effect of physiological hypoxia. Classification. Classification of miscarriage and premature labor, termination of pregnancy. Early spontaneous abortion or miscarriage. Less than 12 weeks till 14. То есть when embryo size can measure. Early abortion till placenta formation. Late abortion. Вот doctor's attention. Ориентир какой? Вот ориентир. Is fetal weight. 500 gram. 500 gram and more. It's что? It's labor. If less 500, it's abortion. It's World Health Organization recommendation. If pregnancy, termination, and fetal weight less 500, it's abortion. More than 500, it's premature labor. For example, in your future practice, you're a family doctor. Husband call, for example, там кто, doctor's name, там Anna Alexandrovna. I'm husband of Maria. My wife has abdominal pain. Please come in as quickly as possible. Doctor go to the home, Maria's home. И что нашла? Found termination of pregnancy. Near Maria, product of conception, placenta, membranes, and fetus or embryo. How we know? It's abortion, spontaneous was at home. It's artificial abortion, or it's premature labor. It's principal difference, that difference situation. we should weight the embryo of fetus. If weight 500 and more, it's premature labor. If less than 500, it's a spontaneous abortion. Prenatal visit. Так, сейчас here.
Yes, madam. Yeah.
Yes, ma'am.
Yes,
Я вас не
madam,
вижу.
we are here.
Unfortunately, I can't see you. Ага. Так, сейчас мы посмотрим с вами фильм. Prenatal care.
My name's
Doctors, do you see?
No, madam.
No, madam. No.
Пока не видите. Да, сейчас. Так, doctors, do you see now?
हाँ, installation failed, madam. Error दिखा रहा है.
Ага, сейчас еще раз. Так. Do you see now?
Да.
Yes, ma'am.
Yes, ma'am.
Do you see?
Yes, madam. Yes.
Medical Center, and we're going to be taking you through the prenatal care clinic this morning so you can see what we do to work with women to provide them with excellent prenatal care. What we do during prenatal care is talk to women about a whole host of issues, provide them with lots of advice for their pregnancy, and help them detect any problems that come up throughout the pregnancy. By doing this, we can help women have healthier babies, babies that are less likely to be premature, and we can also help women with their own health. A full-term pregnancy is 40 weeks. So for the first 28 weeks or so, we see you about once a month. Then the visits get more frequent, going to about every 3 weeks, then about every 2 weeks, and then after 36 weeks, we see you weekly. Great, so welcome, Andrea. Congratulations on the pregnancy. This is so exciting. Yes. Oh, good. One of the first things you want to do is find out about your medical history, because things that have happened in your medical history or your family's medical history may be relevant to this pregnancy. So the type of things we like to know about are diabetes, hypertension, or any other pregnancy complications that occurred either in your pregnancies previously, or sisters, or your mother. We test for some infections such as syphilis, and we'll also offer you a test for HIV. We ask you for your consent for that. So what do you think of that? Have you thought about an HIV test while you're pregnant? Definitely, I think mental health is the best gift that I can give to my baby, and I'd like to find out all of the information that I can. Another important question, Andrea, is medication. So were you taking any medications when you became pregnant? No, I wasn't. Now, how about right now? What are you taking? My biggest actually visit, my doctor then told me that I could start taking multivitamins. That's great. Yes, it's started up before. That's great. It's really important for women to take a multivitamin before they become pregnant. And then once you become pregnant, switch over to a prenatal vitamin. Although the vitamins are very similar, the important factor is that we have high levels of folic acid, which is so important for pregnancy outcomes. And I imagine that the medical assistant for you today and weigh in. Yes. And how did everything look? Everything was great. She said I was within normal range. That's great. The important thing there is that it's not weight alone, but weight and height. And we want to see where you are before you become pregnant in the early part of pregnancy. And then we'll give you weight goals for yourself, given that you're healthy and normal weight. The average weight we expect is about 25 to 30 pounds. So, Andrea, the other things you probably did on the way in will have your blood pressure check and have your urine dip. Did you have those two things? What we watch for during pregnancy is a rapid change in blood pressure. So we look at the baseline blood pressure, and if it jumps from that baseline, then we start to be concerned about gestational hypertension, or in its more severe form, preeclampsia. Let's talk about your pregnancy and when your due date is. The way we date a pregnancy is we start with the first day of your last menstrual period. And some people ask why, and the answer is probably just that that's a day you can identify. Starting on the first day of your last menstrual period, we calculate forward 40 weeks, and we often use a pregnancy wheel. This is a pregnancy wheel, and we'll line up the arrow here with the first day of your last menstrual period, and that helps us calculate forward to 40 weeks, and that's going to be your due date. So with my handy dandy wheel here, I calculate with the last menstrual period of May 19th that your due date is February 23rd. Is that what you had in mind? Okay, great. So you'll have most flexibility in over. Let's do that. At the first visit, we take some tests. The first is a pap smear test, which looks at the cells of the cervix to make sure there's no cancer cells there. We also take cultures of the cervix to assure that there's no infection. So what we do is we have you put your fingers down the cervix. We'll place the speculum in your vagina. That'll allow us to see your cervix. Then we take some cells with a brush for the pap smears. We take some material with a Q-tip for the cultures, and then you're all done. After that, we do what's called a bimanual exam, and a bimanual exam is where we feel with two hands, one in the vagina and one at the top of your uterus, to feel that your uterus is growing appropriately.
Так, давайте продолжим. Let's continue. Мгм. Доктор Джойси,
Mhm.
Yes,
Yeah.
ma'am.
Yes,
special,
madam.
special investigation. Early pregnancy, biochemical, biophysical. Да, у нас два. Значит, examine fetus, все понятно, да? I hope you understood. And what about mother? Mother, the patient too, да? We should examine all system, all organs. No, the better before pregnancy, 3 months before pregnancy. It's called pre-gravidal preparation, pre-gravidal preparing to pregnancy. Heart system, heart or cardiovascular system, neural system, urinary tract, gastrointestinal tract, да? And bones too. All of this must be examined before pregnancy. If patient visited doctor in your life first during pregnancy, we should take on anamnesis history. What history? Family, history, gynecological, да? And history of previous pregnancy, and prevent possible pathology. First trimester, general examination, personal history, menstrual, obstetric, gynecological, family, physical examination, pelvic size, да? And vaginal examination to check signs of pregnancy and pathology associated with the pregnancy. No, for example, uterine tumor, myoma uterine pregnancy, possible to possible. Ovarian tumor, possible. Risk and prevention of abortion or preterm. No, for example, cervical effacement, cervical incompetence. First labor was premature. Possible to have, yes. Help to doctor, что? History, gynecological history. Laboratory investigation, we said, да? It's a risk of torch infection, cervical cancer, pap test, and check glucose level, да? Glucose level test for diabetes mellitus, diagnostic diabetes mellitus. Итак, this slide, doctors, this slide is estimated date of delivery. It's examiner question. It's practical skills credit. Пожалуйста, make photo. LMP. What day of menstruation? Attention. First, last normal menstruation. It's very, very important. Minus 3 months плюс 7 days. Это что будет? Date of delivery. Not gestational age. It's date of delivery. According to date 20 weeks, multipara 18 weeks. So if patient know first fetal kicking September of September, да, 15th of September. Patient prima para, how many weeks gestation prima para had? Which is why we should for 40. Это будет 40 weeks. 40 weeks. Ovulatory test plus 38 according to date of conception. Not all patients know when pregnancy start, but can know. We should ask. According to first visit to antenatal determination of gestation. No. Knows 5-6 gestation. Значит, we should open calendar. And what? How many gestation today? Until 40, it's delivery day. That's according to gestational age. Ultrasound. Doctor will measure bones by parietal and computers, ultrasound computer calculate gestational age. And patient opinion, very much pay age. In some doctor has no, it's not for student, it's only for doctor, experienced doctor. Fundus the top of using the first your hand and fixed in symphysis. Result size of the uterus according to gestational age. Weight gain during pregnancy. Doctor, this is examinal question. Weight gain. Obesity. 3.5 kg, placenta half kg, amniotic fluid till 1 liter, uterus till 1 kg, memory. Смотрите, blood weight 45% according blood volume circulation. Usually 1.5 liter, interstitial fluid 1.5, and no, 5, 3.5, total weight gain 12 till 15 kg during pregnancy. Normal weight gain according phenotype. If patient normastenic 1240, hyperstenic, what weight gain should? Less